We're now going to hear from the President of the Australian BPD Foundation, Rita Brown. Could you make Rita welcome to the stage, please?
Gee, thank you, Dee, and thank you to Songwoman Marucci for a warm welcome to country. It's a real pleasure to be in this beautiful state of yours again. However, a bit of trivia, it's actually warmer in Melbourne today than it is here in Brisbane. I'd also like to take this opportunity to acknowledge the Turrbal people, the traditional owners of the land on which we're gathering today, and pay our respect to their elders past, present and emerging. A welcome to all of you, and thank you for attending our 8th annual National Conference, and also a thank you to our sponsors. Without their support, days like today would not be possible. Although our first BPD conference was held in Melbourne in 2011, the Australian BPD Foundation was formally launched at the Sydney conference just under 5 years ago. At the time, our patron Jan McMahon, OAM, spoke about 2013 marking 50 years since Martin Luther King made his famous "I Have a Dream" speech, which accompanied the momentous demonstration representing hope for the equality of African Americans. She too had a dream which epitomises the Foundation's vision. I would like to share some of her speech, except I've changed her I to a we. We have a dream that people affected by borderline personality disorder will be able to access services designed to meet their needs, that families are supported, clinicians and all those who choose to treat and support people with BPD also are supported. We have a dream that people affected by BPD are treated with respect and there is no longer discrimination within mental health services based on a diagnosis. We have a dream that people are seen as themselves, not a diagnosis, and that a robust statewide service is established in all Australian jurisdictions. We have a dream that a National Institute or Centre of Excellence is established to roll out national training, research and data collection. We have a dream that all of us accept the challenge of raising awareness of BPD, that we all have a task to become the champions for people with lived experience, for carers and everybody who works with people with BPD within our workplaces, friendships and communities. 5 years later, I believe we're heading in the right direction, though I do wish to acknowledge we have a long way to go. I need to acknowledge the enormous contribution of Jan McMahon and our inaugural president, Julie McDonald, who have both worked tirelessly to guide the early formation of the Foundation and to help us to get to where we are today. Reflecting on what we've achieved, we've held an annual conference. This is our 8th, and in fact it's the 7th that I've attended, which brings together the lived experience voices of people with BPD, their families, carers, with that of clinicians, so we can all listen to and learn from one another. With funding from the National Mental Health Commission, we've implemented a stage 1 of a 4-stage national training strategy. Stage 1 includes a series of 6 webinars and the establishment of a virtual library. Past webinars are available via our website, and the next will be held on the 26th of September on the topic of management and self-injury and management of self-injury and suicidality, which follows on really well from the presentation, the workshop given by Sathya Rao yesterday. To date, each webinar has attracted nearly 2,000 participants, so it just goes to show the need that's out there. For the last couple of years, we've taken on the role of coordinating a collaboration of organisations and individuals to promote BPD Awareness Week, and part of that's to refresh the Awareness Week website. This year, the theme is No BPD, K-N-O-W, BPD, No, N-O, stigma. And I'm sure you've seen the posters around and a number of people are wearing badge. So we're in the process of developing an anti-stigma and awareness campaign, and we have a number of those resources on display today and in the exhibition area. Marley, who will be speaking later, Marley has been the graphic designer and she'll be also talking more in her keynote presentation about stigma around borderline personality disorder. So if you or your organisation are interested in being part of this exciting campaign, we would love to hear from you. So I'll be down in the Roma room during the breaks. We distribute our monthly e-bulletin, which provides resources and information about various educational events and trainings, and a quarterly newsletter, the BPD Advocate, to nearly 1,000 subscribers. We now have branches in most states and are currently having conversations with Mind Australia re the establishment of a Queensland branch. We are also preparing a submission to the Medicare Benefits Scheme Review to advocate for up to 40 sessions per annum under the Better Access to Mental Health Scheme, and we've got a petition going and we encourage you to sign that petition. So further information about any of the above or to sign the petition, please see us at our table in the Roma room. We also have multiple copies of the National Health and Medical Research Council clinical guidelines for the management of borderline personality disorder, which we encourage you to take several copies and give them round to your workplace and to your colleagues. It's an excellent resource. It's developed by an expert reference group of clinicians and people with lived experience and also their families. One of our chief objectives for the next 12 months is to actually review that document to make sure that it's up to date with current best practice. Despite what we and others have achieved to date, it is of great concern to us that people are still reaching out for help, and all too often they are not able to access the treatment and support they need. A new study from Project Air Strategy does offer us some encouragement. The study shows a positive attitudinal shift towards the treatment of people with borderline personality disorder over the past 15 years. Something does seem to be working. There is a shift. We're certainly not there yet. Events such as this conference are a celebration of the importance of everyone standing together to support to talk about BPD, what needs to be done, and building connections to ensure that everyone is able to access the support they need when they need it. We are stronger together. I hope you enjoy the day.